deciding to do a residency can be a big decision for people, but once you decide and you get in, it's also a decision that most really cherish and appreciate. Stay tuned as we talk to a PGY1, a first year general practice dentistry residency, a resident who's doing her residency, and she's going to tell us all about her process, how she got in, but also what the residency year is like so far. So stay tuned. Hey, this is Dr. Darwin, new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show. We talk about getting into dental school, getting into residency, life as a resident, which we're going to be talking about today, and then overall life as a new dentist. Guys, be sure that you are continuing to share this information, comment, also subscribe, because you being able to receive this information and utilize it for yourself, but also sharing with colleagues or other individuals that you think that can use it is very beneficial. Subscribing helps, commenting also helps, but also sharing is caring as well. All right. Also, be sure to stay all the way through. In today's episode is being brought to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com, the ultimate resource to help you prepare your application, your list of programs and schools that you're considering, and then also getting to the interview day and crushing the interview. For more information and more details, go down to the link below and go to GetIntoDentalResidency.com. All right, guys, special guest from current resident from my home residency place, I can say, place where I did my residency, place where I also served as program director for several years. So good to be able to reach back, see other folks, and most importantly, talk to folks that are going through the residency right now. So today we're joined with Dr. Rush. Dr. Rush, how you doing?
I'm good. How are you, Dr. Darwin?
I'm good. Well, probably not as good as you because you get ready to finish up this first year of residency,
Yep.
right?
Coming up.
Life after dental school. So for those of us that are meeting you for the first time, please introduce yourselves and tell us a little bit more about yourself as well.
Okay, my name is Dr. Arielle Rush. I was born in New York here, but I've been living in Alabama, and I attended the University of Maryland School of Dentistry. I graduated just last year, so I'm finishing up now my first year of residency, and I'm looking forward to starting my second year soon.
So you said another place that's very dear to my heart, and I didn't even know. I didn't even know you're a graduate of Maryland. Okay.
Yes,
We have another thing in common. University of Maryland, the first dental
the first
school
dental school.
on the planet, not in the US, not in North America, but on the planet. I think that's right. Another first. So awesome. So from Alabama to
Maryland,
Baltimore,
to New
to
York.
Maryland, to New York. Yep, to New York. Gotcha. So let's dive in. Let's dive in because this topic can go either way, meaning there's there are proponents that say, yeah, you got to do a residency. The people that say, no, you don't have to. You could. Some people say, well, you really should. You should strongly consider it, right? And other people say, oh, I can just work and that'll be my residency. So let's talk about why you decided to do a residency after dental school. Again, keeping in mind that it's not required unless you're trying to get a license in New York and a couple other states. But overall, as a profession, it's very different than how it is for medicine, where
Right.
the residency training is part of their formalized training as well. So why did you decide to do a GPR, do a dental residency?
I decided to do a GPR because when I graduated from dental school, I knew that I was competent in everything I needed to know to be a dentist. I knew I passed my boards. Of course, I was able to graduate. I knew basically everything I needed to know, but I feel like I didn't quite have enough experience to be comfortable working as a dentist. So a GPR has been that bridge between dental school and working as a professional dentist. I feel that there were some things that I could only learn and have only learned from experience that I learned at my GPR that I didn't quite have enough experience with in dental school. So I'm a proponent for doing at least 1 year of residency, even if a person is just deciding to do general. I think that doing a year at least of a residency program is definitely beneficial.
And we'll talk a little bit more about some of the benefits and some of the things that you like so far, or you've liked overall these last 10 months or so.
Mhm.
We'll go into that. But also, we want to talk a little bit, just really briefly, about not only your decision, but how you went about going through this process. Because, as you know, if you're looking at general dentistry residency programs, there are over close to 300,
Mhm.
200, two to 300. I forget what the number is. I have it here somewhere. And that's for just both the hospital-based programs and then also the AAGD, which is advanced education in general dentistry. That's usually school-based, or it could be FQHC based as well. FQHC stands for Federal Qualified Health Center. So with your process, what were some of the things that you think was very beneficial for you as you were going through this process of, you know, maybe not only looking at programs in New York, but maybe you were looking programs in Maryland. Maybe you were looking at programs across the country where you maybe wanted to explore, so that after residency, you wanted to maybe practice and perform dentistry, deliver dentistry, maybe in California or Texas or Oregon or Missouri. Tell us a little bit about how you put together and how you put your thoughts together for this entire process of applying to residency.
I knew that I wanted to be in New York. I have some family here. I wanted to be a little closer to them. I knew that I wanted to be in a hospital-based program, so I knew I was looking at GPRs. And Bronxcare was one that appealed to me because it had pretty much everything I was looking for. There were other applicants from University of Maryland that graduated with me that were applying here too, so I strongly considered it. And then everything just seemed to come together with the interview and the whole application process. So I felt that this was the place that I wanted to come to. But knowing that I wanted to do a hospital-based program in New York and things just kind of lined up for me to come here, that's how I made my decision to come to Bronxcare.
Gotcha, gotcha. And currently, how many people are in the program with you?
We have about 16 first years and one second year PGY residents in our program this year.
Gotcha, gotcha. You mentioned something about considering a second year, possibly.
Yes, I'm already decided that I am going to do a second year here.
Awesome, awesome. I'm sure the team and the family will greatly benefit from you being there, and you will as well. So I know they're glad to have you. Hey everyone, it's Dr. Darwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So If you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. So let's talk a little bit about the residency itself. Again, over 250 different programs throughout the country. And guess what? If you've seen 250 programs or more, guess what? You've seen 250 programs. No programs are similar. They may have some similarities, but they're not the same, right? There's many ways in which residency programs will demonstrate how they comply with the standards set forth by CODA, which is the Commission on Dental Accreditation. Every hospital, every residency program does it a slightly different way, right? So share with us a little bit more about at Bronxcare, what a typical week looks like for you as a PGY1 or a first-year resident.
We are in the clinic from Monday to Friday, usually about 9 to 5. There may be a few days during the week where we'll have to come in for an 8 a.m. lecture or presentations. Some morning lectures are via Zoom. And then sometimes we may have an afternoon lecture. Sometimes there'll even be food and different companies will come and bring their products to us, and we can ask them questions. We have different lecturers that come and speak to us. But typically it's a 9 to 5 with lectures either in the morning or in the afternoon. And then, of course, just because of the volume of patients that we see, it's usual to stay just a little bit later after clinic, doing notes, writing referrals, and things like that. But typically, it's pretty similar every day, Monday through Friday.
Now, I know at one point, Bronxcare had the size of the program was such that the residents were split into kind of like two groups. One group, or half the residents, were in comprehensive care, right? Where they were stationed at several of the satellite clinics throughout the Bronx that were part of the Bronxcare health system. Some of the residents were doing comp care for 6 months, while the other residents were doing what we call rotations, in the different areas like dental emergency and going to the OR and participating in anesthesia, also in family medicine. They also had rotations in what we call endo, and also rotations in pedo and oral surgery and ortho as well. In that typical week, what is it like now? And what has been your experience? Are you doing comprehensive care in addition to the rotations and the specialty areas, or is it still split up half of the year here and other half on this side?
So it's not split in half anymore. At the beginning of the year, they gave us a whole schedule with where we would be each week. So most of the time I'm in my regular clinic doing comprehensive care. That's just regular general dentistry, a little bit of everything. But there are some rotations, like for example, I just finished my oral surgery rotation, and that was 8 weeks. I had a week of family medicine not too long ago. I had 2 weeks of dental anesthesia back, I think, in October. But after every rotation, I always come back to my regular clinic. So everything's all mixed up, all mixed together now. We also have emergency medicine. We have our perio, pediatric, and orthodontic rotation as well. So we usually spend at least a week in each of those rotations, but we always come back to our home clinic.
Now you mentioned emergency medicine. Is that similar to or the same thing as dental emergency? Or how is that similar or different? What's the format now?
I have not had that rotation yet. I think it's coming up
Okay.
for me in a couple months. But I'm assuming that it's different from dental emergency medicine because it's one of those rotations that we have in the hospital. So I imagine that it won't be dental cases, but actual medical emergency cases that we'll be seeing. The dental emergency rotation is in our clinic, in our home clinic.
Right. And for that rotation, what do you have you had that one yet?
I have. That's a fun one.
Okay. That's a
Yeah,
fun. Okay. Well,
it is.
well, I'm glad you said that because I remember a couple of residents like, oh no, Dr. Hayes, this is not fun. Like these patients, blah 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 blah. So it's all it all depends on your viewpoint, right? And
Right, right.
what you are willing to understand as part of your journey and being able to learn how to deliver care and manage care and triage folks. So, but
Right, exactly.
you said that was a fun one. So why was that
Yes.
rotation fun for you? I'm talking about
Well,
dental emergency.
I like it. This is another reason why I like dentistry because this is not life or death. A dental emergency means that someone needs to have their tooth extracted. Somebody has an infection. Someone lost their crown. It's usually not a huge, scary situation. So when patients come in, I like doing the triaging, taking the x-ray, taking a look at it, having the discussion with them about, do you want to save the tooth or not? If you want to save the tooth, these are your options. If you don't want to save the tooth, these are your options. And then taking the patient over to the oral surgery clinic if they need the tooth extracted, or if we decide to save the tooth, doing a quick pulpotomy or something just to get them out of pain, prescribing them some medications, and getting them set up, of course, with an exam for a future date. But I like the dental emergency rotation. It's
Yeah,
exciting.
oh, it's exciting.
It's exciting.
It's definitely exciting. You'll get to be exposed to many different personalities as well
Oh, definitely.
doing that rotation, right? Many
Never a dull
different
moment.
personalities. But at the end of the day, you know, we know that the individuals and the people really do appreciate the fact that you're getting them out of pain,
Oh, absolutely.
right? And how you manage that, how you learn to manage that, and how you interact with those individuals is a great foundation for future endeavors when you're going to be doing the same thing
Yes.
for folks. So you're right. That experience alone on how to triage, how to quickly get to the
The root of the problem.
root of the problem, right?
Mhm.
And being able to provide care for individuals so they can get some immediate pain, but also let them know all right, Miss Jones, this is preventable, right?
Right. Right.
You need to see me some
And
more. Like
And the dental
you
emergency
may,
rotation is a good place to have that discussion with patients because a lot of these patients are in these situations because they're afraid of coming into the dentist at all. They wait till they're in
right,
pain. And so now that you're here, let's have a discussion about how we can prevent this from happening again.
right.
When I have a patient who is anxious and they've stayed away for years and years, and they finally come in because they can't take the pain anymore, I say, yes, we can get you out of pain, but let me also give you this appointment slip so we can schedule an exam for you. We can plan any fillings, cleanings, whatever you need so that you don't have to be in the situation again.
Yeah. And it's a simple question of, all right, Miss Jones, you're in pain right now. I'm gonna get you out of pain, but
Mhm.
when are you coming? When you gonna have pain again?
Exactly.
And they look at me like, what? Yeah, when are
Yeah.
you going to have pain again? Well, I don't know. Well, I don't know either. And that's part of the reason why I don't know, because you may have some other teeth that are on the precipice, on the
Yep.
cuffs of getting ready to,
It's
you
never
know,
just one tooth.
yeah, yeah, you get ready to have one or more teeth that are going to
Yeah.
be causing you a problem this time in 2 months. And I know you don't want that, right? Oh, no, I don't want that. Let's look at your
Yep.
full mouth because it only takes one tooth in your mouth to cause the same pain that you're having. And I know you don't want that again. No, I don't want that again. Getting them into comprehensive care to
Right.
do that. So, those are some of the things that are satisfying, not only for us as providers, but also you as a resident, knowing that you can greatly influence and contribute, enhance somebody's quality of life just by getting them out of pain and triaging them. And these are some of the things that you learn as a resident. So you mentioned dental ER, like, and the fact that you like that rotation. Let's talk a little bit more about other things that you like overall about this residency. What are some of the things that have been the highlight for you these past 10 months of doing a residency? What things do you like the most and why?
I think that so far the last 10 months have strengthened my decision to be general because I like a little bit of everything. When I do the different rotations, I come back to my home clinic with that fresh knowledge. And when I speak to patients about their treatment plan, I can discuss it from a standpoint of not just that I read about this or heard about this in dental school, but I've done this a few times. I know what happens when we send you over to this specialist. Let me tell you exactly what you need, what exactly you're going to go through, exactly what you're going to be experiencing, because I've done it now. I like being able to see just my comfort level and efficiency improve since I've started. I think just overall, knowing that my confidence has grown so much in the last 10 months, that has been my favorite aspect so far. Just bringing everything, all the specialties together when you're doing treatment planning and discussing options with patients, being able to bring everything together has been my favorite experience so far.
And that's a good point. That's a great point. There's something to be said about repetition.
Mhm.
There's something to be said about experience. And there's something to be said about exposure, right? To the point where you feel more comfortable, like you just said, to the point where you are working more efficiently, right? Problem solving, getting to the root of the problem, getting the patient some immediate resolution to pain, right? Knowing how to do that and feel confident and knowing that the patients are responding positively to that. And
Right.
then last but not least is the confidence. The confidence is so very important. We as providers need to have that confidence and feel comfortable with that level of confidence because guess what? Patients
They can
can
tell.
read. They can tell,
Yeah.
right? They can tell. They can read, body language, how we say things, how we don't say things, facial expressions, words that we use. Well, I think versus, well, Miss Jones, I know I'm gonna get you out of pain. You know, just the words that you use, all the things that you will continue to develop as a resident by doing a residency, because also that competence and comfort level and efficiency comes from seeing multiple patients throughout
Exactly.
the day in an environment that's totally different than dental school,
Right.
right? Now, last time I checked, last time I was at Maryland and had residents uh, at Bronxcare and other programs that came from Maryland, they came from a school environment where you typically saw 2 patients a
Yeah.
day.
Two, no more than three patients
Yeah.
a day. Yeah.
And if you did more than 2 or 3, maybe you were doing an externship or you were one of the uh uh clerks. We had a thing called
Right.
clerks
Yeah.
where they still have that, right? Where you
They
would
do.
be able to go shadow in the pediatric dentistry residency program or endo program or oral surgery program, and you're working with the residents who may be seeing more than, of course, uh uh 2 patients a day. You would see a multiple of patients and you would be contributing to care. You'll be in that environment. But if you're not in that environment, 2, 1 in the morning, 1 in the afternoon, or
Mhm.
maybe 1 in the morning and 2 in the afternoon. But
Mhm.
that's it. So 3 patients a day. Now, Doc, you tell everybody as a resident, what's the typical number of patients that you're seeing in a given day? Not even talking about rotations, especially
Uh-huh.
not even talking about DER, not the dental
Right.
emergencies.
That's different.
Just a typical average number of patients you're seeing in a day.
On average, I see about 10 patients a day now.
10
And I
patients
remember
a
as a
day.
dental student, that seemed so like so many people. How can you even remember that many things about 10 different people every day? But now it's very doable now. 10 patients a day. I keep a little notebook with, I write my little notes so that when I'm going back and writing the visit notes, I know all the little details. It's easy, of course, to stay organized also when you have the assistants helping you. We have great assistants that help to keep you organized too. But 10 patients a day is usually the number that I see. Sometimes it's a little less, sometimes it's a little more, but on average, it's about 10 people a day.
So those of you who are listening and watching, you're going to go from 2 to 3 patients a day, and you're going to 5x that. Probably on average, you're going to 5x it just by doing a residency. Yes, you're going to probably do the same thing maybe in private practice, but at a different level, probably of comfort, probably at a different level of efficiency, and probably at a different level of confidence. Because when you're treating patients in a residency setting as a licensed provider, guess what? You're also getting the support of everyone else that's there, who are there to teach, support you, and help you problem solve at the same time. So that level of confidence again comes from repetition and number of patients that you're seeing on a regular basis without, and this is key, without the fear that if you do something wrong, it's going to affect your bottom line,
Right.
or it's going to affect the bottom line of the office slash residency program slash institution, right? You've got backup that's there that will guide you step by step, but also support you as you are leading those steps through those procedures as well. So you mentioned some great things as far as how uh, this program, doing a residency, the things that you like the most, and how it's really strengthened your decision to be a GP. And for some people, doing residency also will solidify the opposite. The reasons why they don't want to do GP, don't want to be a general dentist, and maybe are leaning towards a specialty because they have found something doing the residency year that, because of the repetition, because of the guidance of the attendings, they have now seen an area that they really like, whether it's root canals, maybe it's extractions, maybe it's delivering dentures that may lead them towards the path of a specialist as well. So you like those things. So let's talk a little bit about some of the challenging things about going from dental school to a residency. What are some of the challenging things that you've encountered?
The biggest challenge that I'm facing currently is just finding time to have a life a little bit outside of residency. Residency, it takes up a lot of your time. It's more than a 9 to 5 sometimes. I mentioned that there's lecture at 8. You'll stay sometimes later to do notes. Like that's your entire day sometimes. So just making time for yourself, making sure that you are, taking care of yourself, still spending time with your family, friends, um, just balancing your life, keeping that work-life balance for me so far probably been the biggest challenge of residency. It was similar in dental school, but more so now
Yeah, well, because you're responsible for more
for
people,
more people.
and that's part of the process as a new dentist. That's part of your process, that growth, that development,
Right.
professional development. So related to that, the work-life balance,
Mhm.
what are some of the things that you're doing as a resident, as an individual, to manage and make sure that that challenge is not challenging
Uh-huh.
anymore? Because that's the important part. The fact that you've identified what the challenge is. All right, so what's the next step? Like, what things are you implementing to ensure that you have the balance that you want as you're learning how to manage those responsibilities as a provider?
The best thing that's been helping for me is just forcing yourself to take out some time for yourself. So if in the morning that means that you need to wake up even just 30 minutes earlier to make sure that you have a peaceful morning and you actually have time to wake up and process and be yourself before you run to clinic and go deal with people all day long, then that's beneficial. Or even in the afternoon, making sure that when you come home, don't just sit on the couch and watch TV, have some dinner, call your family, speak to somebody, talk on the phone, um, visit people, be productive, do a little cleaning or cooking or something that's going to help you the next day or throughout the week. That's what's been helping me the most. Just making sure that I implement a little bit of extra time to make sure that I'm still having some time for myself, for my family, for my friends, all of that.
Absolutely. Absolutely. Same thing that all of us have had to do when we were in dental school, right?
Exactly.
Same thing.
Exactly.
So it doesn't change that much. You will always have to find
Always
what that
find my
balance is,
balance.
and putting in action and put it in action, right?
Mhm.
Me, right? Me, M-E, you are important. So you have to
Right.
make time for
Gotta
yourself.
make time for yourself too.
Because there's never going to be a complete balance of everything. But
Right.
it's
And
good to hear
sometimes that
that.
means taking the time. So yes, you're tired, but you want to sleep in, but maybe you should go to the gym this morning. You want to sleep in this weekend, maybe you should just take a walk in the park or something. Do something different, switch it up. It'll be
Yep.
beneficial.
Yep. Or maybe you go to another restaurant, a new
Go
restaurant you
find a
haven't
new
been to
restaurant.
before. You got to
Exactly.
eat,
You got to make
got
time
to
for your
eat,
life.
got to work. You got to get some fresh air. Why
Yeah.
go to a new place where you can walk and learn more about the city that you're doing your residency in? Go for a walk. You got to walk anyway. You got to get the blood circulating anyway. So
And
that sounds good.
sorry, Dr. Darwin, that's
No.
another point that I forgot to mention. In dental school, when you came home from clinic, there was a lot of homework to do. But in residency,
Mm.
there's not as much. You still have
Hmm.
some presentations and research to do, but there's not as much homework. So for the most part, when you come home, you can relax a little bit. So
Yeah.
that's something that I've also enjoyed since starting residency. There's not as much
Now,
homework, so you can go take a walk and go to this restaurant without any guilt. You can actually enjoy yourself after work.
yeah. Yeah. Now you mentioned homework.
Mhm.
And in residency, there's different types of homework, right?
Different types of homework.
There's homework where you're preparing for the next day's schedule of patients, whether it's refreshing about uh, uh, access openings for endo, or how many potential, what's the percentage of a lateral canal on one of the teeth that you're getting ready to work on, so that you're prepared and anticipating
Mhm.
that, or whether it's certain steps in the denture adjustment slash
Right.
teeth setting slash a try-in process, right? But also unique to a GPR residency is a code of standard related to scientific literature, and the ability for residents at this level, providers at this level, to be familiar with and be taught and also demonstrate how they are able to uh, review scientific literature as a way of being able to uh, uh, perpetuate lifelong learning, right? And I know from all of my experiences of being at Bronxcare that that's integrated into the curriculum, and it is for all the GPR programs across the country. You have what we call evidence-based dentistry. You may have a journal club. You have these different assignments. So talk a little bit about what research, because that's really what we're talking about, research that's required both in the curriculum, and then also what, if there's anything that's required related to what you as a resident have to present.
So we have all of the above that you mentioned. We have an EBD lecture that is usually once a week, and we have journal club too. In addition to that, we have a treatment planning presentation that we make at the end of the year. So we choose a case that we've seen and we just discuss how We met the patient at their initial appointment. We discussed the treatment plan. We may take some pictures and show the progression throughout the patient's treatment and then the end result. So just showing that you're able to take a patient from initial diagnostic exam all the way to completing all of their treatment. That's one of our projects. We also have an end of the year project where we can pick any topic within dentistry and of course do the research necessary to have a presentation about that at the end of the year. So definitely research is something that is strongly encouraged. But for an applicant who maybe doesn't have a strong research background, I found that in my residency program, the faculty are very, very willing and able to help you out. If you have any questions, they can help you. I've never been afraid to ask a question or ask for help with our faculty. So we definitely do a lot of those research things that you mentioned.
Yeah, yeah. And Dr. Ubu, I know she heads that up.
Yeah, she teaches
Very
the EBD
knowledgeable,
class and
very,
the
yeah,
journal class.
it makes it easier when you have an individual and an expert like her kind of teaching that um curriculum requirement. You mentioned end of the year project and EBD. So just give us an idea of what you're considering for your end of the year topic or presentation.
So my end of the year topic is use of nitrous oxide for anxious patients. Like I mentioned before, anxiety is a major factor that keeps patients out of the dental office. And sometimes they can let their teeth get really bad while they're scared to come in. So I saw a patient who requested nitrous, and so she was medically able to have nitrous. And so I did about, I think it was 3 root canals with her under nitrous. So that was a great experience. One of the faculty from the oral surgery clinic also came over and checked on me periodically, made sure everything was hooked up the way we're supposed to. He taught me what numbers to look at on the capnograph and all of that, the pulse oximeter. So I learned all those little details. So I decided that that was going to be the topic for my end of year project. I'm actually presenting that this week.
Nice. That's nice. That's nice. And tell us a little bit more about some of the EBD or evidence-based dentistry assignments that you have that are part of this lifelong learning and things that you're learning how to evaluate and go through. Tell us a little bit about those assignments in the PICO, what PICO
Right.
stands for.
So we at first we had an exam that we took with Dr. Ubu, and it was just to assess our baseline of knowledge about EBDM topics. And so we took that at the beginning of the year, and we took it again at when our EBDM class ended, I believe like a month ago, just for a comparison. And then in the beginning of the year, we also had PICO assignments where we picked a topic in dentistry, and we had to list out the different letters for PICO, the population, the intervention, the comparison, and the outcome of different topics for research. And we would have to turn that in, I want to say every month. In addition to that, we have the journal club and an EBD project. Yes, that was a group project that we had. That was actually kind of fun. We made it into a game of Jeopardy. So we picked a topic and we came up with all the questions and made it into a game for the rest of the residents. We of course gave them the articles ahead of time so they could study them and be prepared for the game. But that was a lot of fun.
So it again, another advantage of doing a residency is allowing you, providing you some additional tools that we don't get in dental school, unfortunately, because it's just not enough time, but it's enough time in residency where you can learn the importance of evaluating the literature, evaluating the science behind some of the new products that are coming out, that have come out, and whether or not the claims that the manufacturer have are consistent with what the science says, right? And what the literature shows over the course of years. All things that are valuable that are going to help you as a practitioner after residency,
Right.
10, 15, 20 years from now, because you still will need to implement those things that you're learning, that you've learned, and you're responsible for any of those changes that are in the evidence and what the evidence demonstrates as you're delivering care. That's part of our duty and responsibility and obligation as a licensed oral health practitioner, right? We're the
Right.
experts, so we're responsible for understanding all of that information and having that foundation strengthened even more in residency, even if you're going to be just a general dentist, but definitely for the other specialties as well, right?
Right.
Their programs are even more in depth related to research and the foundations of research, and actually even having a research project, survey, study that must be implemented as part of their specialty training. So there's a reason why you're doing this, but also something that's another advantage of doing a residency that you may not necessarily just get directly right from going into private practice and being able to do that. If you guys are finding this very valuable, please put a comment down below, share it, says, give us a thumbs up, and also comment valuable as well down below. That'll help us make sure that other people can see and hear and watch this episode as well. So finishing up here, tips, advice, knowing what you know now after 10 months, having some things that you really like, having to manage your time and your efforts, transitioning from dental student to dental resident. What are some tips and advice that you have for incoming residents, or even people that are considering residency or on the fence, and then those that have already made that decision that are going to be starting in July? What's some tips and advice that you have for them?
Number one tip is to do some kind of residency. I feel like that has helped me tremendously. Like I mentioned before, just building up my speed and my confidence and my comfort level, even just with explaining things to patients. When you've done things over and over, repetition deepens the impression. I feel like this year has been a year of tremendous growth for me. I would definitely recommend that anybody who's kind of on the fence about whether or not they want to do a GPR or even an AGD or any kind of residency, they definitely should do it. I would recommend that if you're the type of person who wants to be studying in between graduation and residency, take a break, take your time, because once residency starts, like I said, you're going to be fighting for that work-life balance. So take that vacation, definitely relax before starting residency. I would say make sure that you have a strong support system that you can lean on. I've been very grateful to my family and friends for always being there to support me, even if it's just a listening ear over the phone sometimes. Make sure you have a strong support system, because you'll need it. But that's, I think, the top 3 tips that I have for any incoming residents or anyone who's on the fence about whether or not to do a residency after graduation.
Sounds good. What's the future look like? I know you mentioned a second year.
Right.
Any other things that you're working on, interests that you have and plans in addition to the second year?
So yes, I will be doing a second year here at Bronxcare. And then after that, I will be looking for a job. Still not 100% sure if I want to be working in corporate dentistry or if I want to join a practice. It'll likely be some kind of associateship, ideally. But that's my plan for after next year.
Sounds good. Well, best luck, best of luck, but more importantly, continued success. Continued success, because luck doesn't count. You need continued success like you've been having. What's the best way for people to contact you if they have some questions or just want to connect with you?
Yeah, if anyone has any questions, they can reach me at arush@bronxcare.com. So .org. That's the letter ARUSH at bronxcare.org. That's my email, and they can reach me that way.
All right, that's up top there. Take a look. Shout out to Dr. Rush, and also shout out to Bronxcare and all the other residency programs doing the great work of making people more comfortable, making providers, new dentists more comfortable, more efficient, more competent, and also more confident
Right.
as well. All the reasons why you should strongly consider doing a residency. All right. So thanks, Dr. Rush.
Thank you, Dr.
Thank
Darwin.
you
It's
so
been a
much.
pleasure.
Shout out to you. Continued success. And next thing for everybody, go to the next video. Go to the next episode. Go right now. Go.